Hi there, it's Gabrielle Nicolay from Speech Kids, where we teach little kids to talk and help parents understand their little kids. And today I am really delighted to be talking to Dr. Dan Shapiro. Dr. Dan, thank you for being here.
It's my pleasure, Gabrielle. Thanks for having me.
Dr. Dan is a valued resource and just all around sort of go-to source of a lot of information for both parents and clinicians like myself. But Dr. Dan, tell the good people who you are and what you do.
Well, I'm a developmental behavioral pediatrician in Rockville, Maryland. So a good percentage of my time is consulting directly with parents, seeing kids when there's not a pandemic. I'm a Zoom doctor now, like so many of us, and I really look forward to the day where I can be in the same room with people again. But also, I've got these parent training groups, training and support groups called Parent-Child Journey that I'd love to talk about. The idea here is to cut through the availability and affordability crisis in our field to make services available to parents. And it's been a pretty cool model with a pay what you can approach where parents who can pay more, we thank them very much. It allows parents who can't pay to access these programs as well. So we've got all different variations on themes with parent groups, and I'd love to talk more about that.
I want you also, and we're going to get to that. I want to ask you though, what is the difference between a developmental behavioral pediatrician and a regular pediatrician, please?
Well, I've been both. So the first part of my career, I did primary care, general pediatrics, the checkups and the ear infections and asthma and other issues that come up, the whole range of pediatric and adolescent medicine. So that's the generalist, your primary care provider. There are all sorts of pediatric subspecialties, as you all know: pediatric cardiology, pediatric nephrology, pediatric psychiatry, and there's pediatric development and behavior. And that's what I do now. So it's a subspecialty of pediatrics that's still pretty broad. Most of us see a lot of kids with autism, ADHD, learning disabilities, mood regulation problems, movement disorders, genetic syndromes. And it's our job to sort out what's going on when a child's development is different, when a child's behavior is challenging. Once we formulate a theory about where these problems are coming from, then hopefully we come up with an effective plan. And it's my strong bias to individualize that plan based on what's going on with each child.
Yeah. Now, it's interesting as you're talking, because a lot of times, certainly the clients who come to me, the families who come to me, the most obvious thing happening is, you know, my child's not talking, or my child is not talking clearly, right? So some variation of one of the other of those. But it's occurring to me, you know, are those people who should be seeing you first, or should they come and see me first and I should send them to you? How does that work in your mind?
If there is a clear reason for a child's differences, if a child's not talking, then to see a speech language pathologist first makes a lot of sense. And a good speech language pathologist like yourself, a great one, will not just evaluate speech, but do some screening about general development. Any good clinician doesn't just look with blinders on. We should all be generalists at heart. You've got your deep expertise with speech and language, but you also have some broad expertise about development and behavior. So people like me count on people like you to screen. So if there is pretty much a speech language issue that's front burner, that's the core issue, and it's clear that's where the work should be done, then go for it, Gabrielle, and all you speech language therapists out there. But if there seems to be a bigger package, which there very, very often is, if there's a question about a child's social engagement, and could there be an autism spectrum issue? If there's a question about attention regulation, could there be ADHD along for the ride? Are there mood regulation issues? Could there be anxiety or depression? along with the speech language problem, et cetera, et cetera. Are there family issues where we need parents to get some support, family systems approach? What about the school? Is that a contributing factor? Do we need to get some educators involved to help out there? And I could go on and on about possible coexisting conditions.
Yeah.
So that broad look is crucial. So if there's a question about something else going on, then to get a generalist involved, like a developmental behavioral pediatrician, makes a lot of sense. So people like you and I will often team up because speech language issues, as you know as well as anybody in the world, usually don't travel alone.
No.
Usually
No,
there are some other questions that need to be answered.
Yeah, and I always have my fingers crossed that is the only thing going on. And sometimes we get in and that's the case. And sometimes I am calling you, as you know, and saying, can you see this guy for me? So thank you. I think that's, those are questions that parents often have, and most of the people who will watch this are parents. And to be honest, I don't think I've ever heard a clearer explanation of sort of how that process works. So thank you.
Yeah, so if a parent has general concerns across domains, then you might start with a developmental behavioral pediatrician or a developmental psychologist. But if a parent thinks that the front burner issue is domain specific, to use lingo, forgive me, but if, for example, just a speech problem, then it makes sense to start with a specialist there and have them do the screening. So I'm always asking, how many magic wands do you need? If you're pretty sure that, hey, for now, I think I just need one magic wand, for example, for a speech delay, then go with that specialist. If you're thinking, hey, I'm not sure how many magic wands I need. There's a speech issue, but there's a self-regulation issue. There's all sorts of other things. Then you go to a generalist and they help you maybe pare down the number of magic wands and the type of magic wands that are necessary. So sometimes those diagnostic questions are broader.
Super interesting. And so that brings us, so now I know from experience that your practice is your sort of pediatric in-person, in-practice Zoom practice is full often. And there's an access problem.
Unfortunately the case for lots of us,
And there's an access problem because I think you don't take insurance. Is that correct?
Correct, yeah.
So that gets billed separately, and that's a whole other conversation for a different day. But so you created a really, really wonderful program. So let's jump right into that.
Thanks. And it was out of necessity that Parent-Child Journey was created. So when you've got a lot more kids who need help than doctors who can provide it, I think there's an ethical imperative to do something about it. So Parent-Child Journey started as a fairly ordinary, 10 to 12 parents at a time, parent training groups and behavior management. And then my partner in all of this, Sarah Wayland, who's absolutely wonderful, a parent navigator, helps parents with case management.
And you should check out my interview with Sarah a couple of weeks ago.
Yep, Sarah's the greatest. So just the greatest. So she came up with the idea to approach Prince George's County ARC and get a grant. And this is quite a few years ago now, where for $5 per session, parents were able to come and instead of 10 or 12 parents sitting there in a nice, neat and tidy, homey circle, there were 84 parents in this big community center. And I look at Sarah and she looks at me and said, well, let's go for it. So handed me a handheld mic, like a talk show host. And I was totally uncomfortable and thought this is not going to work. But it turned out to be great. There was this buzz in the room. There was comfort in numbers. People, felt like hey, I'm with other parents who are struggling also. And it was one of the best groups I've ever done. And I thought, well, gee, if this can work with a group this size and keep the costs down. That's how the pay what you can model was born. We decided, hey, let's just open up whatever people can pitch in, and deliberately we'll have larger groups so that we never have to say no, and that we never have to say, sorry, you can't afford this. And since then, there have been not 84 in a group, but often in my groups, the registration is 40 to 60 parents per group. And when people first enter, they think, well, how is this going to work? But it turns out that people can have a lot of opportunity to interact with each other, ask questions of me, have breakout groups. And it's been a pleasant surprise, a very different model than I've seen elsewhere. But if we keep thinking, doing things the old way, one-on-one or even small groups, we're saying, no, we're pricing a lot of parents out. So I'm excited about it. And the next incarnation of this has been recording the content of the Parent-Child Journey program, which is an integrated 10-session program, very logical progression.
I want to stop you there for just a second. Can you give, obviously you couldn't possibly give the whole program, but what's the arc? What's the gist?
Yep. So the first mile, it's a river metaphor.
I love, okay, I'm going to stop you again. I'm sorry, but this program is beautifully constructed in its metaphorical reach. The book is beautiful. The artwork is beautiful. If you don't have this book, you should buy this book.
Thank you.
His word for it, take mine.
Thank you.
Anyway, okay. Proceed, please.
And the artwork is amazing. Actually, my kids' math teacher, John Watkins Chow, is this extraordinary artist, as you'll see from the book. And we've got this cute little fable about two birds of a different feather, emphasizing the importance of appreciating developmental difference and how they kind of work out their differences and navigate this river, and what happens on. And each little vignette in the fable really serves as a metaphor for the lessons that are being taught for parents in each mile of the journey. So the first session is all about understanding where problem behaviors and problem situations come from. What is it about your child, and what is it about you as a parent? What is it about your family system? Even broader than that, the school, neighborhood, especially these days with racial justice issues, pandemic issues, on the West Coast, the environmental disasters. We don't exist in a vacuum. So a lot of parent programs treat children as if they live in solitary, but we're all embedded as human beings. So the assessment tool looks primarily at the child, but it does take a broader look. And what we do is ask, hey, what is it about this child that explains the problem situations and problem behaviors? That understanding guides management. And to be effective, we've got to individualize the approach. One size does not fit at all. So after we do that initial assessment, then we go through one tool at a time and talk about how to use that tool for your child. It's all about individualizing the approach. And that's the theme of the program. So we go through proactive strategies first, how to get out in front of problem behaviors, set the kids up for success. And then we also cover reactive strategies, what to do when things don't go well, when there are difficult moments, how to keep things from escalating, how to avoid being in power struggles. And then the program ends with a look up the road, how to do your own care coordination, thinking about the years ahead. So that's the 10-mile journey program. And then there's a separate set of programs that I call the excursions, which are special topics in raising your challenging child. Those are one-off, a la carte, pick what you're interested in topics like ADHD, anxiety, social success, eating problems, sleeping problems, gender and sexuality, exposure to violence, adolescence, etc.
Mm-hmm.
So you've got the 10-session integrated journey program. That's a package. And then you've got the pick what you're interested in excursions. And that's the whole platter.
And when people come to your program, do their children already have a diagnosis or not? Or what's their status in that regard?
It's a broad range.
Mm-hmm.
So many of the kids have a diagnosis or more than one diagnosis. Many of them don't and have challenging behaviors or challenging temperaments.
Mm-hmm.
And but it is geared for parents of challenging children. So this is the graduate level parenting course. There are some wonderful first line parenting courses out there for parents of typically developing kids, and many of them are absolutely wonderful.
Yeah.
This is really geared for parents whose children have special needs. Mm-hmm. And but all different ages. We get past chronological age pretty quickly to developmental age. And we don't make a sweeping generalization even about a child's developmental age, because they might be very advanced in verbal language or have very significant social emotional problems, or vice versa. So we talk about the developmental age in each domain, because so many kids have uneven profiles, advanced in some areas, delayed in others.
And I say this all the time to parents, you know, the problem comes when there are these big disparate developmental stages, because the child at some level is aware that they're really good at some things and really bad at others, and they can't quite bridge the gap. And that's where the challenging behaviors come from, as you know. And then parents are also at a loss because they're saying, well, actually the one I hear most often is, well, he could do it yesterday, right?
Right. Yeah. So performance inconsistency, I couldn't agree with you more, Gabrielle, is one of the most misunderstood parts of all of this. It's as if kids are being blamed for their success. Hey, if you could do it yesterday, why can't you do it today?
Pony up. Come on. Come on.
And if these kids could speak for themselves, they'd say, well, that's my problem. I have difficulty with performance consistency. Yeah. And that's what I need help with. So it's not willful disobedience. It's not, trying to give you a hard time. It's not poor motivation. It's just a developmental difference that we want to help the kids overcome.
One of the things that I really take in my practice, and we have a similar type group running also called Raising Orchids, that's very much sort of, I would call it Dr. Dan Light. But one of the things is, we are meeting the child, right? It's a very child-focused, child-centered, and it assumes the best, right? It assumes that behavior is really just kind of a misguided attempt at getting one's needs met, and not willful disobedience, for example. Yep. Not, well, they just don't care about XYZ. And that's like a major shift for most parents. Do you see those light bulb moments in your courses?
Yeah, absolutely. And I live by that philosophy as well, Gabrielle. So, many people have read Ross Greene's wonderful book, The Explosive Child. And he is famous for saying things so simply and elegantly. And he says, children do well when they can. And I believe that in my heart. I also believe that parents do well when they can. And this is where my approach maybe goes a little bit beyond some others, where we don't just understand why things are hard for the child. We want to understand why things are hard for parents.
Yes.
And we want to see, get past shame and guilt and blame. Parents are often very, very hard on themselves. There's a lot of perfectionism out there amongst parents. And We want self-acceptance for the parents, not just acceptance of the child. And we just put everything out there on the table, and don't talk about parent deficit disorder or teacher deficit disorder.
Yeah.
And certainly not, put any artificial limits on what the child might be able to learn, and just say, hey, why is there a problem? Let's do something about it. So yeah, it's a Martin Luther King Jr. quote that I've used for years that is now being cited given the racial justice issues in our country. King said that a riot is at bottom the language of the unheard.
Oh.
And so you might not like a riot, but you had better understand why it's happening.
Oh,
And
wow.
you might not like certain aspects of your child's behavior, but you would better understand where it's coming from. And so if we just treat riots, treat child challenging behavior as an attempt just to make trouble, and don't understand where it's coming from, it's very, very, very counterproductive.
Mm-hmm. Mm-hmm. Oh, wow. I really had full body goosebumps when you said that, because that's exactly it.
Yeah. Behavior is communication. An old phrase in my profession.
Yep.
Behavior is communication.
Communication.
And speech language people have taught me that, hey, you need to look past what a child can't say to what they're trying to say,
Right.
and help them express that better.
One of the things that you, I think, spend a lot of time in your class, and certainly I have learned a lot from this, is something called time in.
Yep.
So tell me about time in, because I will tell you, time in is the basis for the screenless teletherapy that I'm doing.
Cool.
So I have these young kids, right? The screen is not appropriate for them. They should not be on screens. My camera's off. I'm talking to the parents through the headset. And we are doing time in,
Yep.
right? Guided time in. So What is time in? Why do we do it? What is it?
Well, the idea with time in is to make your child the leader, and you're the follower. Now, this is not a way of life. This is just an oasis, a little carve out of time where your child is getting positive attention just for being who they are. So there have been many, many different versions of time in offered by many, many different child development experts. So Barkley talks about special time, and his phrase, no commands, no teaching, no questions, is one that I recommend in time in. The applied behavior analysis people talk about positive pairing, where before you start expecting things of kids, you just establish a relationship. You give them attention just for being who they are in the same room with you. So there's all different variations on this theme. And so time in is giving positive attention for whatever your child gravitates to. So you need to do a little environmental control so that you don't have to be saying no, 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 no. Yeah. So if there's a room in your house that's child friendly, if there's a fenced in playground in your neighborhood, a backyard where your child can do what they want to do, and you are just giving individualized positive attention. Some kids like the verbal sportscaster narrator approach. Whoa, you got the red Lego on top of the yellow one. That's getting so tall. Look at it, it's getting taller and taller. Whoa, it's getting all the way up to the ceiling. You know,
and sometimes that's just too much.
Yeah. And some kids like that. Other kids, that's way too much. That's too direct, too explicit, too animated. And here's where we individualize everything in parent-child journey. Yeah. And I'm often having to tell parents, as you're suggesting, Gabrielle, tone it down, no words at all, just facial expression, body language, make yourself small, just be present. And so we want to customize how we do time in to make it effective. So some parents need to amp it up and use more language. Other parents need to dial it down and use less language. And here's where we talk about that goodness of fit between the child's profile and the parents. So a dirty little secret in behavior management is we modify children's behavior by first modifying adult behavior, our own behavior. So we don't do necessarily what comes naturally to us. Sometimes we need to do things in a way that suits the child's needs, and we might have to be more flexible. So
that's such a pain in the ass, Dan.
It can be difficult for many parents, but it's a skill that can be learned, and that's the second mile in my program. After assessment, time in is foundational stuff.
I had forgotten.
If you don't have that relationship repair, if you don't have that positive foundation, it's hard to build anything else. And some kids have become conditioned to react negatively to the sound of their own name.
Yes.
They hear Timmy, and Timmy's thinking, what are they going to ask me to do that's hard? What did I do wrong? So we want to have kids hear their name, sense their parents' presence, and have positive associations, loving associations. That's a foundation we can build on.
Love. We're going to leave it right there, even though I could talk to you all day. And thank you so much for this interview.
Thank you, Gabrielle. It's always good talking with you.
You too.